To Malaysia now, where 13 new cases, including 9 important ones, were detected. 2 new clusters even. Gail Aldos joins us live from Kuala Lumpur. Hello, Gail.
Hello, Alma. Good afternoon.
Good afternoon.
Here is the latest news. 13 new COVID-19 cases were reported in Malaysia yesterday, comprising of 9 imported and 4 local transmission cases, said by Health Director General Datuk Dr. Nur Hisham Abdullah. He said the imported cases involved 5 Malaysians and 4 foreigners. All of the local transmissions cases involved Malaysians, 2 linked to the Sivaganga cluster and 1 each to the Kurau and Meranti clusters. He said in a statement, for the imported cases, 2 each were from China, India, and Japan, while 1 each was from Ireland, Indonesia, and Yemen. Meanwhile, for the local transmissions, 3 cases were detected in Penang, and 1 was confirmed in the federal territory of Putrajaya. Dr. Nur Hisham said 9 cases were discharged yesterday, bringing the cumulative figures for recoveries to 8,784, or 96.7% of the total number of positive cases. 1 positive case was still being treated in the intensive care unit, but was not on ventilator support. No fatalities were also reported yesterday, with the death toll remaining at 125. On developments concerning the Sivaganga PUI cluster, Dr. Nur Hisham said that so far 4,636 people had been screened, with 45 having tested positive, 4,105 negative, and 486 are still waiting their test results. The COVID-19 screenings were conducted in 3 states, in Kedah, Perlis, and Penang, while screening of close contacts and active case detection are continuing. Dr. Nur Hisham said the Health Ministry had taken various preventive measures like sanitization in several areas identified as closely linked to the cluster. In another related news, 2 new clusters were detected. The Health Ministry has detected 2 more new COVID-19 clusters, the Kurau cluster in Penang and the Meranti cluster in Putrajaya. The Kurau cluster involved 2 positive cases, with the first, case number 9050, reported on August 7th, while the second, case number 9082, was the brother-in-law of case number 9050. The second case was detected through active case detection and close contact screening. Following this, his family in Penang have also been screened. Dr. Nur Hisham said in a statement yesterday, the second case was detected as positive for COVID-19 yesterday on August 9th, while 5 of his family members who have been screened so far have been found negative. He also said to date, 115 close contacts have been screened, with 106 found negative, while 9 more are waiting for the screening test results. Meanwhile, active detection and screening of close contacts are still being conducted. On the Meranti cluster, Dr. Nur Hisham said the positive cases were detected on August 8th when a health worker, case number 9083, was found to be positive. He said the person had contact with case number 8968, which was a COVID-19 case detected through a pre-surgery screening. Upon investigation, case number 8968 was found to have a history of getting treatment at the health facility where case number 9083 was working. Dr. Nur Hisham said the ministry was conducting close contact screening and active case detection activities, with 15 individuals screened, while the cause of the cluster infections is still being investigated. Back to you, Alma.
All right. Thank you very much, Gail, for your updates there. Thank you, EBC Kuala Lumpur Bureau.
Thank you, Alma. Reporting live from Kuala Lumpur, Malaysia, this is Gail Aldos. We live in interesting times.